Urinary incontinence is a problem where the process of urination, also called micturition, happens involuntarily, meaning that a person might urinate without intending to. Urinary incontinence is especially problematic because it affects a person's personal hygiene as well as their social life in a way that can be very limiting. A few types of urinary incontinence. The first is urge incontinence, which is when someone has a sudden urge to urinate because of an overactive bladder, followed immediately by involuntary urination. This is typically due to an uninhibited detrusor muscle that contracts randomly. This usually results in frequent urination, especially at night. To treat urge incontinence, the focus is on decreasing the detrusor muscle activity. Relaxation techniques to relax the bladder as well as antimuscarinic medications can decrease detrusor muscle contractions. Next, there's stress incontinence, which is usually due to increased abdominal pressure that overwhelms the sphincter muscles and allows urine to leak out. Think of things that cause exertion, like sneezing, coughing, and laughing. Anything that puts pressure on the bladder. This is also relevant during pregnancy, when a growing baby puts tremendous pressure on the bladder and causes stress incontinence in some women. The classic finding is urinary leakage with pressure applied to the abdomen. Stress incontinence treatments typically focus on strengthening the external sphincter muscle by doing things like Kegel exercises. Another type is overflow incontinence, which is typically caused by some sort of problem with emptying the bladder. This could be due to a blockage in urine flow, like a hypertrophic prostate in men, which presses on the urethra, or an ineffective detrusor muscle. Either way, the bladder doesn't empty properly, and as a result, the bladder fills up and overflows with urine, which leaks through the sphincters. Typically, this results in a weak or intermittent urinary stream or hesitancy, where it takes a while for the urine to start to flow because of the blockage in the path. Overflow treatments are aimed at re-establishing a clear pathway for urine flow. For example, that might be through catheterization or medications like alpha blockers, which can limit prostate enlargement. Finally, there are various conditions like diabetes, bladder cancer, Parkinson's, and multiple sclerosis, as well as procedures like prostatectomy or hysterectomy that can damage the nerves involved in the micturition reflex, ultimately leading to urinary incontinence. The symptoms and treatment for these problems depend on the exact condition.
Don't forget to like, share, and subscribe to join our growing community of enthusiasts.